Dr. Danish. I'm a senior physiotherapist at Slr Orthopedic and Physiotherapy Clinic. Today I'm going to talk about the topic is called osteoarthritis knee. What is osteoarthritis knee? Osteoarthritis knee is a condition where the cartilage of the knee joint breaks down. When the cartilage of the knee breaks down, it causes reduce in the joint space. It causes rubbing between the joint, and that causes increase in the friction. Because of this, it causes pain, swelling, and stiffness around the knee joint. Women are more prone to develop osteoarthritis of the knee, and the age limit of this is beyond 40, 45. But it can happen to the young also, depending upon this, like they undergo with some injury or some trauma. And what is the cause of the knee joint? Basically, more common cause of the knee joint is of overweight. When the body is overweight, the whole load of the body goes through the knee and that travels through the joint. That causes stress on your knee joint. Second is the injury to the knee joint. Other is a frequent wear and tear to the knee joint when you twist, when you move. Then is the biomechanical abnormalities. What is biomechanical abnormalities? Your feet, your foot. The foot goes into pronation. You have a flat footed. When it is flat footed, it causes stress on the medial aspect of the knee joint. This causes pain around the knee joint, decrease in the joint space. Other is the most common is also the weakness around the knee joint, your quads, your hams, your hip muscles, your back, abdomen muscles. So these are the cause of the osteoarthritis knee. What are the symptoms of the knee joint? The most important symptom of the knee joint is pain, swelling. It aggravates when you get up in the morning, or when you sit for a prolonged period of time, and when you get up, immediately that causes pain and stiffness around the knee joint. Other is you feel cracking sound, crepit. We call it crepitus. When you bend your knee joint, it's called crick sound. That is called the cracking of the knee. You feel popping sound. When you walk, because of the weakness of the VMO, you feel a buckling kind of sensation. So these are all the cause of the knee joint. And one is the swelling around the knee joint, stiffness around the knee joint. Now, what is the diagnosis? Diagnosis is the X-ray, MRI, some blood test is the diagnosis of that. Now, what are the treatment? Treatment is you go. If I'm talking about the orthopedic point of view, with NSAID is painkillers. You can have a painkiller with the consultation with your orthopedic. Do not take any medication, self-medication, because it can cause damage to your kidney. Other is the maintaining healthy weight, because if you reduce your weight, automatically the weight from the knee joint reduce, and this will prevent you from the osteoarthritis of the knee. The other is you can wear a knee brace. Now I'm talking about my physiotherapy part. Physiotherapy part is we have to do exercises. There are a lot of exercises. We do joint mobilization. We use some modalities. We use IFT, laser, ultrasound. There are a lot of other modalities. We use stimulation to build up the strength of the VMO, vastus medialis obliquus, vastus lateralis. Then we do a lot of mobilization, joint mobilization, some of the manipulation. So I'll talk about some of the few exercises which is helpful for developing of the quadriceps muscles, hamstring muscles, hip muscle. So this can be done at home. I am doing it on the floor, but when somebody have pain in the knee joint, he should not go on the floor. He should do on the bed only. So you have to either take a cushion, or you have to take a towel roll, thick towel roll, like this. You have to roll it this much. At home you can use towel roll. So you have to put it under your knee. This you can do either on the sitting, either on the lying down. So you have to lie down like this. You have to press your knee down. When you are pressing, you have to keep in mind you don't have to lift your hip up. You have to just feel the contraction around the knee joint. You have to hold for 5 seconds. 1, 2, 3, 4, 5. Release. Again, you have to press it. 1, 2, 3, 4, 5. Release. This you have to do for 10 repetitions depending upon the pain. The other is the most important. What I'm going to talk about is VMO strengthening. Same position. You have to press it. Maintain the knee pressure. You have to move your foot inward and lift your heel up. 1, 2, 3, 4, 5. You will feel a stress on the activation of the muscle on the medial aspect of the quads. Press it, move your foot inward, it's called inversion. Maintain the pressure on the knee, lift your heel up. You don't have to lift your thigh up. You have to maintain the pressure throughout the exercise. 1, 2, 3, 4, 5. This you have to repeat it for 10 repetitions. Other is same cushion or towel roll between the knee joint. Between the knee joint, what you have to do, you have to squeeze it. Don't have to roll it, just squeeze it. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. This you have to again repeat for 10 repetitions. Same between the heel ankles, you have to squeeze it. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 10 repetitions. Then lying down, again, it's called Slr Straight Leg Raise. Again, foot inward, slightly lift 30 to 40 degree. Hold it. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. This again you have to repeat it for 10 repetitions depending upon how much strength you have, how much pain you have. The other is you have to lie down on the side like this. Shoulder, hip, knee, ankle in a straight line. Lift your thigh, leg up. 1, 2, 3, 4, 5. You'll feel a contraction here, not anywhere else, because if you move like this, the hip flexor will use. So we have to use only gluteus medius and minimus. It should be straight. 1, 2, 3, 4, 5. 10 repetition. This you have to repeat for the other hip also. Same exercise what I have done for the knee, you have to repeat it for the other knee also. You have to lie down on the stomach. When you are lying on the stomach, most of the people have anterior pelvital because of our bad posture. So you have to put a pillow under your tummy. Like this. So you have to bend your knee like this and lift your thigh up. 1, 2, 3, 4, 5. Bend. 1, 2, 3, 4, 5. This you have to do for 10 repetitions. So these are the basic exercises one can do at home. Now, how to prevent the knee pain? Basically, you have to reduce your weight. If you have a lot of pain while walking, you should wear a brace. While climbing stairs or coming down from the stairs, you should hold the rail. Go one by one. Good to heaven, bad to hell is the thing. Like if you have pain in my right, so good will go up, like left will go up. One by one. When you are coming down, back to hell, bad will go first down, and then you have to follow with the other. The other is you can use a stick or the cane to walk with the supported thing. Other, you have to maintain a good sleep, because if you have a good sleep, then everything in the body works well. And like you can do low impact activity exercises like swimming, you can do cycling, but this depends upon the pain and range of motion also. All these exercises you should do in the supervision of the physiotherapist, because these are the basic exercises one can do. But you need some of the mobilization, patellar mobilization, because we see how you walk, what is the gait, what is the strength of your muscle. So we, as a physiotherapist, we stimulate the muscle, we mobilize the joint. So you should do in the supervision of the physiotherapist. This you can do if you have any severe pain, then you can do at home. Now other thing is you can use a hot pack, either ice pack. But if you have a lot of swelling, you can use ice pack. If not, you can use hot pack for 15 to 20 minutes. For the medication, don't use self-medication, because that will affect your kidney, liver. Always consult with your orthopedic for the medication. Thank you so much. Do like our video, share our videos. Thank you so much.